Myself, Dr. Stephen Dice, and today I am coming up with a second session on to how to know about your fertility equations. So today we are going to extensively discuss about your endocrine system and further address the issue of male and female infertility. So let's get started. So to know about your endocrine system, whenever you go to a doctor, the doctor suggests you to do a different hormonal test. So let us try to understand those hormones and what role do they play in our menstrual cycle. So there are many hormones. First one you will come across is a follicle stimulating hormone, that is called as FSH. You will have gonadotropin. You will have luteinizing hormone, LH hormone, estrogen, progesterone, and there are many more. But these hormones that you see are major contributing hormone. Also, there is one more hormone called as AMH hormone. So that is also contributing equally in your menstrual cycle. So let us see now what is the contribution of this hormone in your menstrual cycle. So now if you see this figure, this figure indicates your entire menstrual cycle of 1 month, provided you are having regular menses. And as we discussed in the last series, we have already seen the different components that goes in this cycle. So I will now going to take one step ahead of it and see and tell you the importance of this hormone in the different phases. So if you see this first particular image, this is what you see is the lining of your endometrium, which is nothing but the inner lining of your uterus. And probably if you see this particular phase, which is marked here in red, and this particular phase, it is the phase wherein you are actually bleeding or your menstrual flow is happening. And in this particular phase, if you observe, your endometrium is being shedded off, and that is ultimately resulting in the generation of the blood and the clots. Now, if you come across to the next diagram, you see here is nothing but the development of your egg is taking place in your ovary. And one of the important hormone that is responsible for doing this is follicle stimulating hormone. Also, there is the importance of gonadotropin and also AMH, that is anti-bilirubin hormone. So these all hormones will be equally responsible for generation of an healthy egg, a matured egg, and at the same time they will also be responsible for, to some extent, releasing that egg from the ovary into the fallopian tube at the right time. So your FSH, gonadotropin, AMH, all these hormones plays a contributing role towards the development of your egg in the particular ovary, along with the other hormone also like the estrogen. So this is happening simultaneously as you are bleeding as well. So as you are bleeding here, if you see, the development of the egg in the ovary is still taking place, and that is a phase what we had marked in our previous scenario was the follicular phase, and which I told you it runs almost for 15 days. At the next third one, we have a LH and FSH hormone, that is luteinizing hormone and a follicle stimulating hormone. Now if you see both these hormones in conjunction with the development of your endometrium as well as the development of the egg, you will find that in your follicular phase, the LH hormone is initially when you're bleeding is almost constant, and it is at the minimal level. But as you are moving from your menstrual phase to a follicular phase, the level of this LH hormone shoots up, and it goes on increasing as your production of the egg takes place. And when you are at the peak level, that is the phase when you are at ovulation phase, the LH hormone will be at the peak level, and at that time there will be a release of an egg from your ovary. Once the egg is released, this hormone is gradually going to come down and it is going to settle to its minimal value till this point. And then again in your next cycle, the same scenario is going to repeat. At the same time, your FSH hormone, which is also contributing for the production of the egg, will also see a similar pattern in the scenario. So as your egg development process is taking place, it is going to shoot up, and its contributing factor is still you are ovulated. So once the egg is released, then further your FSH is also going to drop down in a similar fashion like your LH hormone. So that is the significance of these two hormones in relation to a different phase that you see in your menstrual cycle. Next, when we go to this level, here we are looking at the two important hormones, that is estrogen and the progesterone, and what is the relationship that do they have in our menstrual cycle. So if you observe in your menstrual cycle phase when you are bleeding, the estrogen level will be at a sort of a bare minimum level, and as you are going into follicular phase, the estrogen level is going to shoot up and it will be at the peak level when you are ovulating. Once your ovulation is done, it is going to gradually come down and it is going to settle down somewhere here, and probably ultimately it may settle down somewhere to this level. But in relation to this hormone pattern, the progesterone hormone shows a similar opposite pattern. That is, when estrogen is active, the progesterone is not active, and vice versa. So the activation of the progesterone will start towards this level when your estrogen is at peak level, and from there there is a decline in the estrogen level and there is a pickup of the progesterone hormone, and it is going to contribute your major phase of the ovulation at this point and also at the luteal phase. So it is basically responsible for the generation of your endometrium, and if you see where in this particular pattern, when this window wherein the progesterone is a major contributing factor, there is much more lining that has been developed in your endometrium. So it is a contributing factor towards this. Now, in the last slide, I just represented how you can track your ovulation by monitoring your temperature. Now, the temperature that have been listed down here is just for hypothetical thing. It may vary from the region to region, but it gives us an indicator that when are you ovulating. So during your ovulation phase, you will find a sudden increase in your temperature by, let's say, 1 degree or 0.5 degrees, and that increase is going to remain throughout this phase till you start bleeding. So once you start bleeding, it is going to come down and settle to this level. So maintaining a temperature is also a very ideal scenario to keep track of your ovulation, and there are other parameters also to do that, which I will be explaining in the coming series. Having known now the importance of endocrine system in your menstrual flow cycle, we go and ask a question: is will you be bleeding consistently always throughout your journey of reproductive history? Will you be bleeding consistently? The answer is no. You may have variety of different patterns in terms of the bleeding. So here I have listed down the pads with the probable different colors which you yourself might have observed during your menstrual cycle in different scenarios. Here, if you see, there is a very light shaded discharge. Here it is more of a blood. Here is a combination of a blood and somewhat clots, and here it is you find a lot of clots, and many of you will go through one of this particular phase or combination of more of them in your menstrual cycle. Further, I request each and every one of you to please spend some time to have a good look at your menstrual pad, so it conveys a lot of information regarding what is happening inside. So the color of your period can tell you more about your health. So it can last to a very dark in terms of clots, or it can be as light as a pink. That is, it can go to this extreme or it can be this extreme. So please have a look of it because it conveys a lot of information. Now, regarding the periods, there are three cases. One is called as amnoria, which is treated as the absence of the menses. You are not getting your periods. On the other hand, you are getting regular periods. So if you are in this range, you are absolutely fine. And again, I would like to change this range as well, as we have discussed in the previous scenario. This can vary. This is an ideal case, but still within 26 to 34 or 35 is still treated as a normal range in today's scenarios with the changing world. On the other hand, if you are bleeding heavily, then it is going to be a case of menorrhagia. So we will briefly discuss what are these things and then move to the next topic. So amnoria is basically an absence of the menses, and there are two categories of it. One is primary and one is secondary. The primary is the one that is usually found when you don't get your first period at the age of 16. It is basically in your adolescence phase. Then it may be caused because of the following reasons. Is primary amnoria is basically associated with the kids who are not getting their particular first menses even by the age of 16. Nowadays, the kids starts getting their menses even at as early as 9 years. So if suppose a girl is not having her first menses or menstrual symptoms by the age of 15, she needs to visit a doctor to rule out this case. It may be glands which are responsible for sending the signals to your different endocrine system. So if there are some problems over there, then it can get delayed. You can have congenital defect of a female system, which you might have got during the birth itself. Different reasons for a delayed puberty. So these are possible reasons that can result in reasons for a delayed puberty. So these are possible reasons that can result in primary amnoria. Secondary amnoria is the one when you stop getting your regular periods for about 6 months or more. So you had started with your periods, but suddenly they have stopped and they are not coming for about 6 months or more, and you are not pregnant. Then it is a case of secondary amnoria, and the possible causes of it could be anorexia nervosa. Then it can be because of overactive thyroidal gland. That is what we basically call it as hypothyroidism. It could also be because of the ovarian cyst that can be developed in the ovaries, or there could be a sudden weight gain or a loss because of the change in your endocrine system. So all these reasons could result in secondary amnoria. Further, if you are on contraceptive pills, then stopping of the contraceptive pills can also result in stoppage of your periods for some time. Sometimes post-pregnancy, you may also get a delay in starting of your periods, but if it is exceeding 6 months, then it is a little bit of concern and you need to see your doctor. Further, we try to go deep into secondary amnoria in the adults, because once you stop getting the periods for a long period of time, then it is to some extent related to infertility issues. So at a higher level, I mean, for the people who are almost trying to conceive and is observing these symptoms, it can further be classified as premature ovarian failure. This has also been becoming quite common nowadays. It may be because of pelvic inflammatory diseases, a sort of a reproductive infection that is being caused in your pelvic floor. Stopping of a birth control. So if you are on a contraceptives and if you have stopped a birth control, it can result in stoppage of your periods for some time for the other hormones to get in line. Pregnancy, as I had suggested before. Breastfeeding, if you are continuously doing a breastfeeding post-pregnancy, then it may also delay because of the LAM cycle. Next, if you are achieving a menopause, and as you are approaching towards a menopause, you will find a lot of irregularity in your periods, and in one of it, it could have a delay of more than 6 months as well. So, what are the symptoms of the menopause? Because many times women do get this kind of problems as one of the symptoms of menopause as well. That's why I thought of putting up this slide to tell you what are the problems or things that may be associated with the menopause. First and foremost is you will find a lot of changes in your mood. There will be thinning of the hair growth gets reduced. The hair will be losing its elasticity, and also there will be a thinning of your skin. The tone of the skin get changed. Next, you will find sort of the firmness of the breast has been lost. You will also find little bit a risk of a heart damage. That means there may be an increase in your pressure and other heart related problems if you had a previous history. Then it may also result in the stoppage of the period, and as such you may also be more prone to vaginal infection. Second is your urine becomes inconsistent, and it increases also your chances of getting urinary tract infections. So they are more prone, the women in this are more prone to UTI and also the vaginal infection. It doesn't mean that a woman in early age doesn't get this, but a woman who is approaching menopause is more prone to this kind of two things. And one also very important thing that happens is osteoporosis. You tend to lose the calcium from your bone. As such, a good supplement needs to be taken to replenish it. Going to the other extreme, you start getting heavy periods. So amnoria was the absence. Menorrhea is heavy particular menses. It is a result of imbalance in the hormone level, especially your progesterone and estrogen. So I told you the importance of both these hormones in your menstrual cycle, and if there is an imbalance created between both of them, then it may result in a heavy bleeding. Your vaginal infections is also a common cause of the heavy bleeding. Inflammation of the cervix, underactive thyroid gland, that is hypothyroidism. So it is overactive, it will result in the stoppage, that is hypo, and if it is underactive, it will result in more bleeding, that is hypo. Further, it can be also because of non-cancerous uterus tumors, which we basically call it as fibroids. So if you have a lot of fibroids in your uterus, then there are also very high chances that you will go for heavy bleeding. So when I talk about heavy bleeding, we usually consider your menstrual flow in terms of the blood to be for around 7 days. But anything that is continuing post 7 days is a concern. And if the bleeding is not stopping and it is continuously heavy on all the days, then you need to see a doctor immediately. That is the purpose I have put up this image, to get you a feel like to what extent the bleeding can continue, and if there is no stoppage of it is being noticed, immediately report to the doctor, because if you prolong it, there are chances that you may get more anemia because of the loss of the blood. Having discussed all these things, I am taking my discussion to the next topic of infertility in male as well as female. So this image shows the transition of male and female from the adolescence phase to a mature age. So you see a significant amount of the development that is taking up in a female. At the same time, the significant amount of changes that is also happening in the male. And probably a woman in a second and third stage, and so does men in the second and third stage, are in a position for conceiving, for doing sexual activity and trying to conceive. Now, if you see this image, this is a couple who is in the adolescence phase and have almost reached a maturity particular phase wherein they are in a position to particular conceive. So you see a significant amount of development has taken place in both of them in terms of a development of a healthy penis along with the scrotal area. In terms of a woman, the breast development is fully complete, and so does the vaginal area is also complete externally and also the internally. Further, I zoom the area of the scrotal area in a man, and if you observe it among your spouse, you will find that one of the testicles is little bit larger in size compared to the other one. It may be either this one or the other one. Usually it follows this pattern. And also try to observe if there is the movement of this scrotal sac inside these testicles or not. It may not be observed all the time, but if there is a movement of this scrotal sac on top and down, it's an indication that they are fertile or the production of the sperm inside is happening. And again, I'm repeating, it may not happen all the time. So sometimes when it happens, you try to observe it and it's a good indicator that the things are working well inside it. As we discussed from the woman perspective, we cannot see anything from outside because the woman reproductive system is entirely inside. But in case of the men, it is most of the part is outside, plus some things are also inside. But from outer observations, you can get a feel of the reproductive fertility in that particular person. So the importance of this slide is note down the movement of the scrotal area and see if there is a significant amount of movement observed or not. Now, going to the reproductive system in female as well as male. In female, we already discussed and I had highlighted the probable problems where female infertility can happen. And over a period of time in my series of lectures, I'm going to address each one of them. So we had highlighted the first problem can be at ovary. Second problem can be in fallopian tube. Third one can be in your uterus itself in terms of the lining and the environment. Fourth one will be in your cervical channel or the canal and the cervix itself. And the fifth one can be in your vaginal passage. So these are the 5 areas where a woman can have a problem. Some women can have a problem in more than one area as well. So basically, these are the areas which are affected with the female infertility. When it comes to a man, this is the reproductive system of a man, whereas this is the area where you see the testis, endometrium, and the scrotal area, and this is the area where your sperm is being produced, and they are being carried forward by this duct, which you see here, vas deferens, and this duct travels all the way here, and then ultimately it comes out from here. So first problem can be associated with this area itself, which is not producing good quality sperm here. Second problem can be associated, there is a blockage in this duct itself at any one of these places. Third, if you see here, this particular duct is also getting mixed with something called as the barbiturate gland, a copper gland, what we basically call it as. So it is also secreting one more fluid, and that also gets mixed with this fluid, and then ultimately it is being ejaculated all the way from this channel to the outside world. Another important thing that I would also like to make a mention here is there is a prostate gland that you see here. So this is a prostate gland, and your channel vas deferens is going through it. And one more thing that is happening is this is a urinary bladder, and the urine is also coming and meeting at this junction. So it's a junction wherein a urine is going to come from one side and your seminal fluid is going to come from the other side, and then they are going to follow a common channel to pass to the outside world. So at times when a person gets also UTI, urinary tract infection, then it may also create obstruction at this level, and that can also result in infertility to some extent. So unlike women who have a separate opening to pass the urine, the men have a common opening and they share a common passage here to pass the urine as well as the seminal fluid, and this being a junction where the two entities are going to meet, it plays a very critical role. And the problem is these particular things are almost going to pass through your prostate, and men are more prone to get prostate problems like the prostate enlargement, and if your prostate gets enlarged, then this duct which are passing through it are constrained. It may result in ultimately the blockage, and that's why you may feel whenever there is an enlargement of the prostate, you feel a problem in passing the urine and also in the ejaculation. So these are the different areas where a man can have a problem. So it can be 1, it can be 2. The blockage can be here in terms of the prostate thing. The blockage can also lie here, so and so on. So the problem, these are the problems that can be associated with the male infertility. Apart from it, there are other aspects like erectile dysfunction, that is, a penis is not being erected to an extent which it should have been. Also, it doesn't stay erected for a long period of time. So there are multiple reasons also associated with it. One common thing that we have found out is the excessive masturbation. Again, I would like to bring to your notice is masturbation in male as well as the female is a good thing. I'm not criticizing it, but if it is done under a control, then it is a good thing. Anything that is done in excess has a lot of side effects. Maybe in coming series, I will tell you in detail the importance of both of them, but it is good thing for both of you in a limited quantity, and anything in excess is going to have some other problems associated with it, and one of it could be your erectile dysfunction in case of a male. Now, taking our focus to the female particular infertility, I have purposely put up this image because those who are infertile and have tried to conceive and are unable to do so may have gone through it many number of times. So this is your kit that you are testing up. Your result comes out negative. You are always eagerly waiting for the result to be positive. And this is a picture which I like the most, that you are always taking your age clock in your hand and thinking all the time that the time is passing by. So my request to you, if you are having this kind of a feeling, please keep this particular clock besides. We have ample period of time and we will work it out so that you try to conceive naturally in the best possible way. And if that is not possible, then only we go for an alternative way. But first we need to try naturally to do it, because I see a potential in each and every woman to conceive naturally. So when we talk about infertility in a woman, when do we say it is infertile? So this point is applicable for a newlywed couple. So when you can't conceive in 1 year of marriage without using contraceptive, then we can consider it as 1 year. I sometimes increase this window to 1 to 1.5 years, because for a woman to adjust to a new environment in the new family, it might take some time. There might be some stress associated as well. That's why we usually increase the window to 1.5 to 2 years. But anything above it without using the contraceptive may result in finding out that there might be some sort of infertility in female as well as in male. So the reasons of infertility are: you have irregular periods, Since your period is irregular, tracking your ovulation becomes difficult, and as such, you are trying to lose that vital window, which I had explained in my previous window in the video, wherein you can have the intercourse and the chances of conceiving are very high. So once you have irregular period, this schedule of detecting ovulation to some extent gets also shifted. But by using all those methods, some of the methods which I have told you, you can definitely track yourself. And again, I'm repeating, please don't try using the mobile apps which are readily available if you have irregular periods. And even for the regular periods, I don't recommend, because you try to take the signals what your body is giving. Those are the best signals that you can get to find out your status. Second problem of infertility can be poor quality sperm. So when I talk about poor quality of sperm, it may be in terms of the sperm count itself is very low. And even if the count is high, they do not have a good motility factor, which is nothing but, the motility is nothing but the way they can traverse inside and do the fertilization. So if they don't have it, and if the count is also proper, but definitely they are not going to traverse all the way and do the fertilization process. So it can also result in infertility. Stress to adjust to the new environment. This is for a newlywed woman. But when I talk about stress, there can be different types of stress associated. It can be your work stress, it can be your family stress, it can be if you are tried conceiving and you're not conceiving, then other people may say something to you, so you also get stressed. And nowadays we tend to take the stress on minute things, which needs to be avoided if you want to come out of this. But I will also maybe doing one more series on stress management as well. We have career commitments, so many women have career commitments, so as such they give the priority for the career to settle, and in that process they use a different modes of contraceptives available, and then once they decide to have a baby, might be there is an age factor, or might be there are some side effects associated with the contraceptive methods that was adopted, that can also lead to some sort of an infertility. Past trauma. So if you had a past trauma related to the sex, usually it happens in a divorce case, or if you are sexually abused in the past, then a woman tends to have sort of a trauma related to a sex, and she doesn't want to actively participate in the sexual activity, and that to some extent can cause different sort of the problems between the couples, and ultimately it may result in sort of infertility issues. Causes of infertility in women are, one is age, but as long as you are menstruating and you are having healthy periods, the age is not a matter. Also, try to take a history from your mother or from your aunt from the mother's side, what was the age of her achieving menopause, so that will roughly give an indicator where you stand. And the common reason that has been observed is polycystic ovary syndrome, or PCOS, what we call. Endometriosis is another reason, that is, I'll be doing more series on this. Hormonal imbalances, how it can affect, I already explained you before. Uterine factors, if the endometrium, if you have endometriosis and if the endometrium lining is not properly developed, then it may result in infertility, in the sense you may conceive, but the implantation may not occur to an extent, and over a period of time you may get a miscarriage. So ultimately, having a miscarriage also ultimately results in sort of an infertility. You may have the fallopian tube blockages itself, which I've shown you. Ovulation problem, you are not producing healthy eggs. Complications from your past childbirth can also result in you conceiving for the next time. Recurrent miscarriages is also part of infertility thing. Egg reserve, if your AMH hormone, that is anti-bilirubin hormone, your follicle stimulating hormone, all those things are little bit on a lower side. They are not producing a good quality egg. which can ultimately be released and can be fertilized to develop a fetus. So if those follicles are not producing good number of eggs because of the lack of these hormones, we call that you have a low egg reserves. But definitely it can be improved over a period of time, and there are a lot of food supplements and some exercises that can also be done to do a lot of improvement at this level. Eating disorder, eating unhygienic food, junk food can also result in infertility. Most of these things can be corrected over a period of time, and many of you who are in the domain of infertility will be having one or the other problem associated with this. Again, I would like to make a mention that in all the cases, IVF is not the option. In my case, I treat IVF is the last option after trying out all the other methods that can help the couple to conceive naturally. So having listed down the possible causes of infertility, what are the causes of infertility in men is the first and foremost, the volume of the sperm is low, that is the sperm count is low. There is obstruction in the genital tract, that is in the sperm count. So I've shown you the vas deferens duct. So if there is obstruction in that, then the sperm cannot pass and ultimately you are not going to ejaculate the required fluid. There can be structural defect in the sperm itself. So this is at the genetic order level. So that can also result in male infertility. Erectile dysfunction, your anal structure is not getting that erect and it cannot withstand for long period of time. Motility of the sperm, that is they are not motile, that is they cannot make that particular transitions all the way to fertilize. That can also be resulted in male infertility. So these are common things that is observed in male infertility. What are the good habits that you can try out? I'm going to come up with more series specifically on the food supplements as well as the habits, but here I'm just listing down some of them that can be tried. Always try to eat a balanced diet and a healthy diet. When I say balanced diet, it should have a good composition of the vegetables and a good composition of a non-vegetable item in terms of the fish, in terms of the chicken. Try to avoid red meats, try to avoid the canned food and so on. So always try to have a very balanced diet of proteins, vitamins, carbohydrates and so on, and also antioxidants. Try to induce it in your particular diet in the natural form. Restrict the intake of fat because it is going to increase your weight, and the moment your weight increases, there are other problems associated with your infertility. Moderate exercise regime. You need to always keep your body activated. So minimal about half an hour of walk is recommended. If you can do it more than that, it is much more appreciated. But keep your body activated rather than sitting idle at one place for a long period of time. Take a break, have a small walk, but in general, in a day, at least 30 minutes of rigorous walk is a must for both the partners. Restore and maintain a healthy weight. So if you try to follow all these three things, definitely you will be in a position to maintain a healthy weight, which is a must because BMI plays a very significant role, that is body to mass index ratio. So find out a ratio between your weight and the height and see where you stand on the fertility line. So maintaining a good weight is a must, and that can only be controlled by a good exercise and reducing the intake of unnecessary items in your body. Finding a way to deal with stress. Stress has become also a new reason to develop a lot of infertility issues, and as I listed down, there are different levels at which stress can occur, but we need to deal with the way to tackle this, and probably I will also come up with a lecture series on how to manage it. Maintain a healthy lifestyle, avoid junk foods and the drinks, carbonated drinks, the alcohols you try to avoid. you can take a particular red wine, which is very good, but a healthy particular red wine can be taken by both the person, male and female, because it contains almost, a good one will contain almost 0% of alcohol, and it is found to have a good positive effects also in terms of cholesterol management and other things. So try to have it, but avoid all kind of junk foods, avoid red meats, and avoid dairy products like the cheese, like the particular uh, tofu or paneer and so on. So avoid it and have a very good healthy diet system. I'm going to come up with a series of the balanced diet series wherein I'll be explaining you the different diets that you can adopt to make yourself healthy and make yourself fertile. So that completes my series.